All right, so let's kick off this nursing home office hours, understanding and medical exemptions. Today we have Yolanda Velez and Monica Maxwell that are going to lead this conversation today. So I want to bring them on and I will start with Monica. Monica, go ahead.
Thank you so much for that introduction, Rose, and thank you all for joining us this morning. So today we're going to discuss the COVID-19 vaccination exemptions and kind of make some differentiations between the two. We have two types that we're going to talk about. They are medical exemptions and religious or philosophical exemptions, which are often referred to as an accommodation. So these two items are going to be documented differently when you're looking at the National Healthcare Safety Network and you're reporting into those data fields each week. So as we move forward, I'd like to go ahead and focus my part of this presentation on medical exemptions. So medical exemption, these are based on medical contraindications that are very specific and fairly rare. So generally speaking, we're going to talk about if receipt of the vaccine would be bad for one person's health, or if that person has allergies or an allergic reaction to vaccines, and those are really the most common things we're going to look at. And for specific guidance, you can see the link down here on the bottom of the screen, and it will really list out every single criteria that needs to be met for it to be a medical contraindication when you're reporting into NHSN. So there is specific criteria that needs to be met in order for a person to be counted in NHSN as an actual medical exemption to the COVID-19 vaccine. This is going to include people with severe allergic reactions like anaphylaxis after having a previous dose, or an anaphylactic reaction to a component in the COVID-19 vaccine. This will also include people who have a history of a known diagnosed allergy to any component of the vaccine. These contraindications can be having a contraindication to one type of the COVID-19 vaccine, and is really used as a precaution when we're looking at other types of vaccine, specifically between Moderna and Janssen, and also those specifics to the vaccine. So looking at vaccine exemptions, we're going to see that anyone who's had an immediate non-severe allergic reaction to a previous dose, or like I said, has got a known diagnosed allergy to one of the components, they're going to fall into that criteria. And also anyone who's had an immediate allergic reaction to any other vaccines and therapies, and this will include IMs, IVs, or sub-Q vaccines or therapies. But this will exclude anyone who's taking maybe allergy shots. And also, we're going to have exclusions for anyone who's got a history of myocarditis or pericarditis when we're looking at the mRNA COVID-19 vaccines. And for the Janssen vaccine, anyone with a history of Guillain-Barré syndrome would also fall under this criteria of a medical exemption. As we're seeing here on the screen, the NHSN medical contraindications documentation for residents, this is question 3.1, and the specifics are listed here. And also at the very bottom, you've got a link with a PDF that will give you further guidance when we're referring to reporting for residents who have a medical contraindication. This screen displays some of the same information that we just saw on the previous slide, but this is referring to staff and contraindications when related to staff. And there's also a PDF here at the bottom of this screen for your convenience. So looking at when we're documenting into NHSN, and we're going to look at question 3.1, and you can see where the orange arrow is, that any individuals who fall under that criteria of medical contraindication would be listed here on 3.1. And I think at this point, we've got some poll questions. Rose?
We sure do. Monica, what we want to know on this poll is how many of your residents in your facilities have medical exemptions for the COVID-19 vaccines. And then just select the best one. Now, this is your residents. This is your residents. So, you know, have you been hearing a lot of that, Monica and Yolanda, with your facilities, that there are a number, or is it usually pretty low?
I think that it really is a pretty rare instance where you've got an actual medical contraindication that falls under those specific guidelines listed in the interim clinical considerations. So it's not a very common thing to have at all. It does happen occasionally, but there's very specific criteria that need to be met for that definition of an actual medical contraindication when we're referring to reporting into the NHSN.
Okay. Well, the poll has ended, and I know Victor's going to tell us what our participants are seeing in their facilities in just a moment, right, Victor?
That's correct, Rose. We're compiling the results right now, and we'll be able to share them right now.
Awesome. So I'm seeing most say 0. There's 6 people that have 1 to 2. So, Monica, you hit the nail on the head with that one. Well, let's try it with staff. How many of you have staff that have medical exemptions for the COVID-19 vaccines? Monica, do you think this one's gonna rate a little differently?
I do, Rose. I think that, I think that when we're looking at really being very strict and really following the guidelines as far as whether they fall under that category of a medical exemption, I think this kind of brings us to a little bit of a gray area. I know that in the past, we've seen some facilities inadvertently include staff as having a medical contraindication. And when they look a little bit more closely at it, it turns out maybe it's not an actual medical exemption, but something that was, a perceived exemption. So looking at those guidelines and following those guidelines very specifically when you're reporting into NHSN and looking at them on an individual basis is very important.
Indeed, indeed. So, and Dr. Moore, you mentioned one time in a conversation that there are some people that have needle fright. You have a different term for that, but is that a medical exemption?
I think we're talking about the possibility of injection anxiety,
That's
and
it.
it's probably not a medical exemption. There are a number of tactics to deal with that, and there's a lot of literature about it. But a phobia or anxiety about a needle or an injection probably does not qualify as an exemption in this circumstance.
Okay, so look at those poll results. We have 6 that say 0. We have 14 that say 1 to 2. 8 people have said they have 3 to 4, and there's 4 individuals that have 5 or more staff that have medical exemptions. Interesting. It indeed looks a little different, doesn't it? Okay, so let's move on to our next topic, and I'm going to bring in Yolanda. Yolanda, can you talk to us a bit about the religious or philosophical accommodations?
Of course, Rose. Good morning to all of you, and thank you for attending today's presentation. I'm going to talk a little bit about the religious and philosophical accommodations and give you a couple of definitions. CDC defines religious exemption as a vaccine declination because of a sincere held religious belief. The Equal Employment Opportunity Commission, the EEOC, expands on that definition that we have, under the CDC, and they define the religious exemption as to include the sincere religious belief, practice, and observance. So they expand a little bit because these definitions, vary Please check with your HR department how your facility will define and address the religious exemption to COVID-19 vaccinations, because for today's presentation, our goal is actually to provide you some guidance on how to report those religious exemptions in NHSN for data report purposes. So we just wanted to give you a little brief about what the definition is based on CDC and based on the EEOC, but just please check with your HR department how you're going to address it. So let's get started. Under the Omnibus COVID-19 healthcare staff vaccination rule, CMS allows for staff COVID-19 exemptions. Providers should establish exemptions as part of their policies and procedures, and then align them with the federal law. CMS encourages your facilities to review the EEOC compliance manual for religious discrimination for more information about, how these exemptions can be addressed at your facility for your staff who declines the vaccines due to religious beliefs or philosophical beliefs. So although facilities have the flexibility to establish their own processes to allow healthcare workers to request the religious exemption for the vaccine, CMS requires facilities to ensure that requests for religious exemptions are not just only documented, but they are actually reviewed and evaluated by the facility or your corporate people in the HR department to make sure that they also comply with your policies and procedures. So they all have to be aligned. Please check with your HR department and your corporate office, for more guidance, because they might have already policies and procedures that you can use, as well as the form that needs to be requested, that your employees can request. So one important thing is how this religious exemption is going to impact NHSN data reporting. On the vaccination summary report, facilities must report the religious exemption on question 3.2 as offered but declined the COVID-19 vaccine, even if your facility has allowed, this religious and philosophical exemption to be an acceptable exemption for the vaccine. So it's really important to make sure that you look into your, when you look into NHSN on your 3.2 question, there's a couple more things that they expand a little bit about the decline, offer but decline. So here for the residents, this is on the screen you have the resident portion. Here we talk about the residents decline vaccination because of the health conditions that are not considered acceptable by the medical contraindication. So let's say, for example, they have another medical reason that is not one of the ones listed, as Monica mentioned before, on the NHSN list of contraindications, and then you will put them under the offered and decline. Then also the residents who decline the vaccinations because of the religious or philosophical objection. Also, the residents who decline the vaccines and who did not provide you any information. So they just decline, say they don't want to have it, but they don't want to give you a reason. Those you will include as well on this offer but decline. And then finally, we also have the exemption for the healthcare workers. And here, if they're declining for the same, reasons that on the resident section, where you have the healthcare worker declining the vaccine for healthcare conditions other than those the acceptable ones on the medical contraindication for COVID-19 vaccine, the healthcare worker declining because of religious and philosophical objection, and then if they have any other reason that is not included on the medical contraindication, and they don't want to tell you why. So here you have the links also for the instructions. This is the criteria on NHSN, and you have one for the resident as well, where you can look more for details on this explanation. So
and just to remind our folks that in the chat, I've put a link to download the slides. When you do that, all of these links that Monica and Yolanda are pointing out are live so that you can get those documents.
Thank you, Rose. And then here, here's a screenshot about the 3.2 questions. So here in the orange arrow, you can see where the offered but decline is going to be populated. So if you see, you have three options there for the on the 3.0 question. Or if you can go back, Rose, to that prior one, here you can see the medical contraindication, and then you have the offered but declined. That's where your religious and philosophical exemptions will be counted on. And then you also have you're still going to have the unknown category. Okay, thank you. Next slide. There is a change coming up on the vaccination data reporting, and I just wanted to make sure that you are aware that today and today at 1 o'clock, as well as on Thursday, this Thursday, the 3/31, at 1 o'clock, NHSN is going to be providing some training via WebEx webinar, via webinar, and you have to register to attend, but those they're going to be providing an update on this COVID-19 vaccination module changes. So looking at these changes, the facilities will start using this event level COVID-19 form for the healthcare workers and residents in NHSN to report the individual vaccine data and the declinations for religious exemptions. Facilities were going to have an option here, like you see here in this drop down on the screen, that you have the option to select now. Before you used to only put like they have declined. Now you're going to have the option to select that they receive an official religious exemption, or they have another reason for the decline, or they have an unknown. So you have these options now available.
And Yolanda, what I did in chat is I put the link to both the event that is at 1 p.m. Central today on these changes. And then again, if you can't attend today, it's repeated, as Yolanda said, on March 31st at 1 o'clock. I put the live links there if you want to register for that. I think it'd be worthwhile to participate in that webinar, don't you think, Yolanda?
Yes, it is really important. It's going to show you the changes and how this is going to impact your data reporting. One thing that I wanted to mention is that if you look at the screen, you can see different tabs on the top where it says add arrow, and that is because they want, the way this is going to work is that you're going to have your vaccines data in here in this system. Is going to be event level data, and it's going to include every individual like you have it on your worksheets. And then they also, this report right now, when you click on the view reporting summary, it's going to auto-populate your report based on the data that you have entered on this event level form. So it's really important that you attend the webinars today, because they'll go through every detail as well.
Excellent. They can register now.
Yes.
So Yolanda, you get polls too, right?
Yes.
And how about if we find out how many of your residents have religious or philosophical exemptions to the COVID-19 vaccinations? And this may be a little different, Yolanda, than what we saw on the medical exemptions, don't you think?
Yes, you are going to see a higher number compared to the medical exemptions on these religious and philosophical exemptions. Residents as well as healthcare providers have the right to request this based on their sincere held religious beliefs. So I'll expect to see a higher number than the one on the medical contraindications.
And do we sometimes see that residents have these because their caregiver or family are requesting that?
Yes, that's you're also going to see that some of the family members will request these exemptions for their loved ones if they are not, capable of making their own decisions. And sometimes, they just want to make sure that these are addressed at the facility level, so they will request them as well.
Yeah. And Victor has published that poll. 17 say 0.
Mm-hmm.
We have 3 that said 1 to 4, 2 that said 5 to 10, 1, 11 to 15, and 0 for 16 or more. So that's on the residents. Why don't we take a peek at the staff's use of religious or philosophical exemptions? So let's answer this poll. How many of your staff have religious or philosophical exemptions to the COVID-19 vaccinations? What do you think is going to happen with this one?
Yes, and this one you'll also see some increase. And the thing is that because the mandate on the COVID vaccine vaccination for staff as well as for for staff just ended now in March, we'll see an increase on the religious and philosophical exemptions because this was something that was not available before. And now, the staff has the opportunity to express, their interest in having the exemption based on their religious beliefs.
Okay. And that poll is wrapping up right now, Yolanda. We'll see what we see. And I'm going to ask the panel while we're waiting for those results, what are you seeing in your facilities? And attendees, what are you seeing in your facilities as far as the staff religious or philosophical exemptions? I'm looking at the poll results. We had 3 that had 0, 5 had 1 to 4, 8 had 5 to 10, 9, 11 to 15, and 4 had 16 or more. What do you think of those results, Yolanda?
I would expect them to be increasing, and the reason is because before they didn't have an option to select the reasons for the declines. Now that they can see that there's this option, they will we'll see a more increase. And I think that the data that's going to be starting to be collected on NHSN will provide us a lot of more insight about this different options, these different reasons for declining the vaccines, which will also help the facilities as well as us and TMF, to target education if that's something that's needed, if they're declining for any other reasons as well.
And one of our participants mentioned that the religious exemption is really hard to prove. Do they have to prove it?
They have to, the staff members can request the exemption. The facilities will have to follow their policies and procedures to go through the process of reviewing them and then approving them or denying them. And the reason is because it depends on how hard, the hardship that it will represent for the facility based on the services that these staff members provide.
Mm-hmm. Good point. Good point. So let's have some discussion. Yolanda, I'm going to turn it over to you to kick us off.
Okay, so what impact on your NHSN vaccination rate are you seeing, with religious and philosophical exemptions? One thing that I've seen right now is that I'm seeing more religious exemption, more declines reported on NHSN. Right now, I cannot say that they are due to the religious and philosophical exemption because this this a specific data point is just going to be started to be collected. So we expect to see a higher number, eventually, but because facilities will report what they have right now. But before we were only seeing just offered and decline. Have you seen anything different, Monica?
I think definitely that is the trend that I'm seeing as well. I wanted everyone to understand that a corporate policy or a facility policy allowing for philosophical or religious exemptions or an accommodation like we're referring to it, the definition is a little bit different when they're reporting into NHSN. So the main concern is just that we're gathering that data and we're reporting it accurately. Even though it may be an exemption on the part of the individual under their facility, they're still having that data reported in as a decline into the NHSN. So some similarities and some differences, but I do see this number increasing, and I think that it's probably safe to say that this might be a trend that we see for a little bit.
Yes, and I think that, although we are going to, however, I think that many facilities will start seeing a decrease on the unknown status and numbers reported to NHSN, and probably an increase on the offered but decline option. It's just, the most important thing for NHSN purposes is that you accurately report the reason for the declinations on the event level COVID-19 form that's going to be available now in NHSN under your COVID-19 tab. Because, we really want to have the best data being reported, because that's actually how processes and systems gets in place. So,
ladies, we had somebody mention that they lost a nurse and a CNA, and for that small facility, it's really hurt. And she's wondering, how deep will the state dig in when we allow religious exemptions?
This is Sarah. Do y'all want me to take that one?
yes, please.
Go right ahead, Sarah. Thank you.
Well, according to the QSO memo, and I can put the link in chat after I get to telling you, they made a note in there that says surveyors will not evaluate the details of the request for a religious exemption, nor the rationale for the facility's acceptance or denial of the request. Rather, surveyors will review to ensure the facility has an effective process for staff to request a religious exemption for a sincerely held religious belief. And I'll put the link to the memo in the chat.
So what you're saying, as long as the facility has a policy about that, and someone has requested it per their policy, things are okay?
If they have a policy in place and they have gone through that process that is, applicable to their facility, and that policy and procedure follows the federal and state, regulations,
Mm-hmm.
then they will accept it. And then the most important thing is that the facility has a process in place to let the staff know that that is an option that they have. The other thing is that that there is a process in place where they can just review it. It's just not having the staff member request it and then that's it. They need to have a process in place to review those exemptions and then evaluate it and review them or approve them or deny it. And again,
Okay.
that's based on their, the hardship that it will represent for them.
And Sarah did post that link in chat if you'd like to click that and get that particular document. And Christine mentioned that the philosophical exemption is the one she's seeing the most of. And this seems so broad, with reasons not to take the vaccine or booster to fit with the philosophical definition. Anybody else seeing that same thing? And is that a different process than the religious exemption?
Hi, Rose. This is Monica. I think Christine has a really good point here that the philosophical exemption is pretty broad, and it can cover a number of things, not just a specific religious standpoint or religious belief with regard to the vaccine. I think that allowing the facilities and encouraging the facilities to follow their policies and procedures and keeping track of this information is going to definitely be something that's very important, but recognizing that it is not just a religious exemption or accommodation, that it can also move over into philosophical reasons is important for us to acknowledge.
Yep. And Deb mentions that she thinks it is a struggle for most of them to approve. And how do you decide if it's legitimate?
I think
Oh,
that they will have to consult just to the HR department
hmm
and follow the rules. Yeah.
They need to follow their policy and procedure, correct?
Yes,
It's not a personal guess on whether it is or isn't legitimate. It's whether it follows the guidelines of the facility. Is that what I'm hearing, Yolanda?
that's correct.
Okay. It's got to be trying, though, for administrators and directors of nursing and that type of thing when these things come in. I'm sure it's challenging to the HR department, right?
Yes. And my biggest advice is just follow your state and local and federal, rules to make sure that your policies and procedures are aligned with that, and that you have a process in place that you address your philosophical exemption as well as your religious ones, so that way you get everything covered.
Mm-hmm.
Rose, this is Monica. I'd like to say something that kind of piggybacks off of looking at these exemptions or accommodations, if you will. I think it's important for us to also acknowledge that education should still continue, and having educational information available to those who maybe have opted out and had their exemption or accommodation under religious or philosophical categories. I think it's important for us to make sure that we're still offering education if these folks want it or have questions about the vaccine, because it's not a set in stone. Once you have taken this position or requested this exemption from your facility or your corporation, they can still change their mind at any point in time if they choose to do so. So I think it's important for us to still maintain open lines of communication with those who have gone with this exemption or accommodation, making sure that they still have all of the information available to them if they should choose to maybe reconsider having the vaccine or the boosters at any time.
Yep. And Deb mentioned that she is human resources and that they've depended on their lawyers, but it's most definitely a struggle. And April would love it if someone would put the link to the CMS guidance for the employees' religious exemptions. Does somebody have that link?
Are they referring to the QSO memo that I put in the chat that talks about the vaccination, that actually talks about the medical and religious exemptions?
That would be fine, yes.
That's what
Yep.
I put in, that I was referring to, is the guidance
Okay,
for
so
the
if we scroll up, let me just and
Do you want me to put it in chat?
Yeah, I can put it back in there. Mm-hmm.
Rose, while you're finding that, let me just give another perspective on this particular question. While the exemption, the religious philosophical exemption, always centers on an individual employee, I think it's important that the organization takes a holistic view of this in a risk management approach. There's a request, there's an impact on both the individual, the organization, the other employees, and the residents about fulfilling that request or denying the request. So all of those things really need to be taken into consideration about how this works, and about, I guess, really about how far the organization is going to stretch to approve an exemption or accommodation for an employee. And I agree wholeheartedly that we need to continue our educational efforts about COVID, about the vaccines and vaccination recommendations, and also infection control processes and procedures within the facility. If there are a large number of staff who are not vaccinated, does the facility need to reinstitute things like mandatory masking or hand washing or enhanced something for infection control reasons? So this is a really holistic question, and yes, I feel for everyone on trying to determine what should be approved or what shouldn't be approved. And I would steer away from any language that would say that the request is legitimate or not legitimate, or the belief is true or not true, because those are very hard things to prove or disprove. And I congratulate you for consulting with your attorneys about this, because it is a risk management. There's a risk management component.
I totally agree. And the thing is that even if they decline the vaccine, they can, let's say if they do it because of a philosophical exemption, they might, eventually change their mind. They can still, they can remove that exemption request and to get their vaccine.
Indeed.
So education is key. Continued education.
You bet. So we'll go on to the resources. And Yolanda, would you like to take this one?
Yes, here we have two resources for you. One is the long-term care skilled nursing facility attachment A, and including also the list of your contraindications and precautions. And this comes from the CDC.
And Monica, do you want to cover some of the COVID-19 training?
Yes, absolutely. Thank you, Rose. So we have talked in past webinars about the CMS targeted COVID-19 training for our frontline nursing home staff and their management staff as well. This training is available through this link as you see here, and it's CMS's Quality, Safety, and Education portal, which is where we get QSEP. There are 5 frontline nursing home staff modules with about 3 hours worth of training, and 10 management staff modules with about 4 hours of training. And our goal really is to have all of our frontline staff completing this training at 100%. A lot of facilities are instituting this training when they're onboarding new staff, or even utilizing in-service times to go ahead and have staff start completing this information. At the very bottom of this slide, you can see that there are 2 links to group training instructions, and they're offered in English and Spanish for your convenience. With that said, the team here at TMF would like to thank all of you for your attendance today, and thank you for your questions and contributions. If you have questions or require assistance, our team can be reached at nhnetwork@tmf.org. And as always, the team at TMF thanks you for your dedication and commitment to excellence in healthcare.